Thank you, I know. Okay, so a little bit about Heat Finland. So we are having this health webinar series as part of Heat Finland, which is an organization focused on health, education, and integration of immigrants in Finland. So it's a publicly funded project, and we usually provide information on different health issues. We have open well-being days. We also provide individual health guidance to international immigrants, and we arrange some activity groups so they can interact with other immigrants and learn more about their health issues and discuss if they have more health problems that they are facing in Finland. And we also recently started this webinar series. We have these webinars in various languages, and we try to share information on health issues which could be relevant for immigrants. For example, previously we had a webinar on dental care, and now we are having this webinar on blood pressure management. And future will have even more. So please do feel free to share the link and for this webinar, and stay in touch with Heat Finland for any future updates. So today we have two amazing speakers, and for our first speaker will be Dr. Greg, who has a background in epidemiology, who's also a researcher and now currently practicing as a public health physician. And he will be explaining about the details about for how blood pressure management works. And then we have Emma, who is our project expert at Heat Finland, but she's also a senior lecturer, and she has these culture mediation training sessions from now and then as part of Heat. And she's also our certified wellness coach. And she will be telling us how we can manage our blood pressure in a healthy way, of course. So, now, I think I've said that many times, so you will have time for questions. So please do put them in the chat or record them somewhere during the speaking sessions. So you may not be able to ask any questions during the session, but you can ask definitely afterwards. But I guess we can start with our first presentation now. So I think Dr. Greg will share his screen.
Thank you. Can I go now?
Yes, yes, please.
Okay. Should I say very warm good evening to everybody? So today I'll be taking you through high blood pressure, silent but salient killer. And I know everybody can get what the silent is, but the salient part is what I would like to stress more today because it's a very important health condition that we all need to pay attention to. Like she has rightly said, my name is Greg Okobo, and I am an epidemiologist affiliated to the Tampere University. And as an epidemiologist, my work is to study the population and how disease moves through the population so that we can find control measures for them. So there's going to be a bit of a learning outcome. And the very first one is for us to appreciate what is blood pressure. And then we move over to why we should look at high blood pressure. Why does it matter? Then we'll take a deeper dive into the clinical features in terms of symptoms and complications of high blood pressure. And we're going to provide some practical prevention and lifestyle management. My colleague today will speak more in depth to that aspect of today's discussion. So I think the very first question is, what is blood pressure? Um, And before we go too deep into it, what indeed is this blood pressure? So it's the force of blood pushing against the walls of our arteries as the heart pumps. And I can demonstrate it a little bit with this. And you can see that this is the heart, which every one of us do have. That's why we are alive. And its responsibility is to pump blood through the body, which also keeps us alive, gives us nutrients, remove waste from our body. So when the heart pumps blood to the body, it pumps it through these pipes or tubes, which we call arteries. And as it pumps that blood, it goes through the arteries and pushes against the arteries. So those arteries or those pipes being pushed against, that whole force being pushed against the pipe is blood pressure. We need that pressure to keep the blood moving. So it's actually a good thing to have blood pressure and especially to have a normal blood pressure. With a normal blood pressure, as the blood is being pumped out of your heart, the normal blood pressure pushes the blood along the arteries to every part of your body. So blood pressure is one of the things that we need to make sure that the blood circulates around our body. So as the blood goes through the arteries, like you can see in these diagrams, in these motion diagrams, you see the direction of the arrows. They are pushing against the walls, and that push keeps the blood actually flowing. So we need that push, but we also need it to be normal. So to know if your blood pressure is normal or if that force pushing against the arteries as the blood moves along to enable the blood moves along through your body, usually we measure it. And we measure it using this device here. And it has a name, sphygmomanometer. Manometer is anything that is used to measure pressure. So sphygmomanometer measures that force. And we need that force to be within the normal range. Anytime you measure this force, medically, we give two values. There is a number or a value, which we call the systolic blood pressure value, is usually the top number. And then there is another number, the bottom number, which is the diastolic blood pressure value. So it's important that when blood pressure is measured, these two numbers, we pay attention to them. First one is systolic, second is diastolic. The top and the bottom numbers. And the top and bottom numbers will tell us if that force pumping blood through our arteries, through the pipes in our body, if it's within the normal range. And there is a normal range. We expect that in a normal functioning human body, we should have the top number as 120 and the bottom number as 80, less than these numbers, less than 120 for the top number and less than 80 for the bottom number. And the millimeters of mercury is just the unit that we attach to the number to show that this is blood pressure. So if you see mmHg is just the unit. So anytime you do take a blood pressure measurement, you focus on these two numbers. Top, systolic, which tells us when the heart beats. So anytime the heart beats, there is a pressure it beats with, and that should be less than 120 if you put a number to it. And if the heart relaxes a little bit to allow blood come into it, there is a pressure, it does that too. That's a diastolic, and it should be less than 80. And we measure all this using the sphygmomanometer. Now, there is a recommended range for blood pressure, and this is recommended by the World Health Organization. For normal blood pressure, like I have already described, it should be between
Why is that?
120
Take it here. I put it
and 80. The systolic blood pressure should be
here.
less than 120, which is the number on top that tells us when the heart beats. And when the heart relaxes, it is 80, less than 80. But there are sometimes it is between 120 and 139 for the systolic blood pressure, and between 80 and 89 for the diastolic. At this stage, we say this is high normal. It's still normal, but it is high. Some will say pre-hypertension. So if you do measure your blood pressure and you get these numbers within this range, then you can begin to um, be more alert to how to manage your blood pressure and bring it back to normal. Then there is this stage where it is between 140 to 159 systolic and 90 to 99 diastolic. So if you have values within that, we actually say this individual is having high blood pressure or hypertension grade 1. That can escalate to grade 2 with these values, and then grade 3 with these values, which is something we don't wish for. At this point, I must also say that you can have values that are far too less than 120 systolic and far too less than 80 diastolic when you measure your blood pressure. So that is the opposite of it being high. We say you now have hypotension. And hypotension is also not good because remember, the whole essence of blood pressure is to keep blood flowing through your body. So if the pressure at which the blood is flowing is low, it means you won't get enough circulation of blood in your body. And that is hypotension, which is equally bad. But today we are talking about high blood pressure, when that force pumping blood through your body is high, is above 120 systolic and 80 diastolic. So we've explained what blood pressure is. We've seen how it is measured. We've seen the values that it can fall within. So what constitutes high blood pressure, which is also called hypertension? And from the table in the previous slide, you'll notice that there are some values that will say this is pre-hypertension and then hypertension 1, grade 2, and grade 3. So, and this happens when the blood pressure is high and is persistently high, not just high within a moment. It can go up and go back to the normal range. But if it remains elevated persistently, then we say this is high blood pressure or hypertension. And for it to meet the definition of hypertension, the number on top, which is systolic, has to be 140 or more. And the number at the bottom, which is diastolic, 90 or more. At that range of numbers, then we say this individual is having hypertension. It is known as a silent killer, which is part of the topic for today's webinar. And it is a silent killer because it does not often show any symptoms until it starts uh, damaging organs in the body. So the period when it is elevated at the first time, you won't notice anything. It persistently remains elevated and then starts damaging some organs in the body. Then you notice that it is elevated. So that period that you are unable to find out is why it is referred to as a silent killer. So guys need to take care of our blood pressure and make sure it is normal. So why should we care now? Why should we care? Hypertension or high blood pressure is a leading cause of heart disease. So if the blood if the force of pumping the blood through your body is so high, it can lead to heart disease. Just like you are pumping water through a pipe. If the force of pumping the water through the pipe is too much, what happens? Pipe may give way, may explode. Same thing in our body. So the heart may suffer from the high blood pressure and you have heart diseases. And if the pipe or the arteries that takes the blood under very high pressure, if it's in the brain and it gives way in the brain, it explodes in the brain under the pressure, this leads to stroke or what we call cerebrovascular accidents. So stroke is a product also of high blood pressure and kidney failure. Because the kidney is made up of very tiny, tiny cells. If the pressure is too much, it can also destroy these cells in the kidney, and the kidney becomes unable to perform its function in the body. The WHO have estimated that globally, 7.5 million deaths occur every year because of high blood pressure. That is a staggering number. And many people still are unaware that they have it. So there are some people who have elevated, persistent blood pressure, and they don't even know. So they are the people that meet that definition of silent killer. But it is there, it's killing their body, but they don't know. And if you know and you're able to manage it or control it, it can actually save life or your life. This is the global picture of blood pressure. I've used 2010 because I want us to, it takes a little bit of latency period for me to see the full picture in the present term. But this is one of the most accurate statistics that we have out there. And the top is for men and the bottom is for women. So if you look at the scale, the color code tells you the proportion of the population that has elevated blood pressure. And you can see that in Africa, some part of the Middle East and Eastern Europe, more than 34% and above of the population have elevated blood pressure, both in men and in women. And if you look at Finland, where we are, it seems to be more common in women. It seems to be more common in men, I beg your pardon, where you see green, 30% and above, for the picture above, you can see there. And then for the women, you can see here that is blue. And this is for men here. So you see that green and blue, and you can pick out what the percentage are. And this is a global picture. So there is no part of the world that is actually spared. So, but Africa, Latin America here, and Southeast Asia seems to be most affected by this high blood pressure. So it is important that we see the global picture. But if you take a little dive and you look, you see these are all disease conditions that high blood pressure can lead to, from stroke to heart disease, cardiovascular, kidney, and these are the numbers estimated that can occur, that the deaths that can occur just because of hypertension. It can lead to death through these diseases. It contributes to death through these diseases. So it is important that we pay more attention to it. Then if you look at the Finnish situation or the global situation again, like I've said, 1 in 4 men have elevated blood pressure, have high blood pressure. So if you see 4 men and you probabilistically 1 out of every 4 men should, have elevated blood pressure, or 1 in 5 women. That's worldwide. But in Finland, about 2 million Finns have high blood pressure. That's 40% of adults in Finland. How about immigrants population in Finland? African descent, up to 15% in men have elevated or high blood pressure, and 25% in women. And these are statistics from the Immigrant Health Survey done by the THL, which is the foremost government department of health and well-being in Finland. And then if you take a look, hypertension also occurs in pregnancy. And this is why it is very important we have this conversation. And in Finland, as at when the studies were done in 2020, 4.2% of pregnant women from sub-Saharan Africa have hypertension in pregnancy or hypertensive disorders in pregnancy. There are many of them, preeclampsia and so on, but 4.2%. So 4 in every, or say 5 in every 100 women that you see, 5 out of 100 women that you see that are pregnant and they are from sub-Saharan Africa have hypertensive disorders in pregnancy. And this can also lead to kidney failure. And for East Asia, this is 1.3%. So now we know the numbers. We know that hypertension or high blood pressure is fairly common and it can cause some unfavorable outcomes, which can lead to death. So we have to find out what really feeds or causes elevated blood pressure. Why can't our blood pressure just be normal throughout our life? There are two main groups of risk factors. The first is the non-modifiable, which is these are the factors that you cannot change. You are kind of born with it, and they can lead to hypertension or high blood pressure. And then we have the modifiable, which are the ones that we can change. Okay, these are something that we brought upon ourselves, like because of our lifestyle or something. So let's take them quickly, one after the other. So for the non-modifiable, remember things that you can't change. Age. We do know that with increasing age, your probability of having high blood pressure increases. We also do know that if you have someone, first degree relative in your family that has high blood pressure or hypertension, there is an increased probability that you have high blood pressure. We also do know that people from African descent or Asian, they are at a higher risk of having blood pressure, of having high blood pressure. And this we have found out through research as well. Unfortunately, we cannot change or do something about any of those. We cannot stop ourselves from growing old. We have to grow old, and we can't determine the family we are born into. So those are things we can't change. But there are things we can change. They are called the modifiable risk factors. And very one on the list is unhealthy diet, especially when we take too much salt, fats, or low fruit and vegetables. If we have elevated or high body mass index, which can be classified as obesity, that can definitely lead to high blood pressure. If you don't do physical activity, which is simply if you don't move your body, any movement of your body that will require the use of energy is physical activity. So if you don't move your body, then there is a high risk that you may develop high blood pressure. Alcohol and smoking, the twins, they are always there, and they both have been shown to lead to high blood pressure. And stress. I mean, we actually don't say stress, rather we say distress. Stress can be okay for our body to wake up our body to realities of life, and that's fine. But if the stress is persistent, just like the blood pressure is persistent, it leads to distress and your body can't cope anymore, then that can lead to high blood pressure. The symptoms are very, like I said, not noticeable. It's a little bit salient, or it's a little bit silent, not salient. And but we can notice some other symptoms along the way, like headache, dizziness, even nosebleeds. So if an adult suddenly start having nosebleeds, you need to see your doctor. That may be a pointer. Okay, and these complications it can now lead to damage of organs in the body, which we refer to as end organs. A good one is heart, the brain, and the kidney, and sadly, vision. So there are some people who've lost their sight because the blood pressure was too much, and it bleeds into the eye by when the vessels ruptures, bleeds into the eye, and that can lead to vision loss. So these are end organs, and this can be caused by high blood pressure. We've already explained how blood pressure is measured, so I'm going to be a little bit fast with this or even skip. But the most important aspect is the fourth point here. Anytime you want to measure your blood pressure using the sphygmomanometer or maybe the more common the digital devices that we have now, it's advised that you sit in a very comfortable position, and your arm should be at your heart level in case you are doing this personally at home, and you should check it regularly. If you're above 40, every month is not a bad idea to check it. How do we make a diagnosis of hypertension? How do we know that we have hypertension? Like I've explained before, you do measure your blood pressure and it is 140 and above, the upper value, which is systolic, or 90 and above, the lower value. So that can give you a pointer that this is hypertension. We have other ways of also determining if somebody have hypertension, but that is done at the doctor's office. So if you check at home and you see that it's elevated and it remains like that week on week, then you should see the doctor who will carry out all these other tests to know what is happening and give you more detailed advice. Prevention strategy, I'm not going to go too deep because my colleague will spend some time on this, but just as a summary, healthy diets, like you already know, these are modifiable, especially reduce salt intake. Less than a teaspoon per day is advised. Exercise, especially the aerobic exercises, walking, cycling, not powerlifting and bodybuilding. So those are anaerobic exercises. And then you maintain a healthy weight. Of course, avoid smoking. Even a single drag of smoke can lead to that. And limit alcohol intake. And there is what we refer to as sensible alcohol intake. I do hope my colleague will talk more on that. And then you have to develop a culture of relaxation so that you can manage stress, join support groups, sleep. You need at least, as an adult, on average, 8 hours of sleep. If that's a child, that shoots to 10 hours. So, but for adults, 8 hours, I know some of us do sleep 4 hours, but that is not sufficient for your body to be relaxed from stress. The treatment is exactly the same, but this treatment is for those who have been diagnosed hypertensive or people who have high blood pressure. The very first thing that the doctor will tell you to do is to make sure you take care of those modifiable risk factors, which is diet, exercise, and stress. And then you can be placed on medication, sometimes for life. It is not a death sentence. Those drugs, you can take them and you live a prosperous, gracious life. So and these are some of the drugs that we do prescribe as doctors. And keep on the follow-up visits to your doctor. Usually, they will always ask you to come back for checkups. That is so important so that they can reduce the drugs as your blood pressure is controlled. They also don't want your blood pressure to be too low, become hypotension. It can also cause devastating problems. and make sure you keep to the drugs. So living in Finland, these are my practical tips. And I think this should be about the last slide, or second to the last, I guess. You have to assess the healthcare. And in Finland, in some circumstances, it seems to be free or subsidized. So you are in a very good um, country where you can access the health system and get your blood pressure checked. What I do, my practice is a day or a week close to my birthday every year, I go for health checkup, whether I'm sick or not. So I do it every year. So I know I'm guaranteed that once a year, close to my birthday, I know it's a reminder. That's the best reminder I can get for myself to go and check myself and make sure I'm okay. So you also have to register with a local health center. And if you need language, maybe because you're an immigrant, please request for it. And I'm sure the system will provide one. And like we've said, join support groups and take care of yourself. So these are the takeaway for you. Hypertension is common, is serious, but preventable and treatable. You have to know your numbers. 120/80, systolic, diastolic. 120/80. That's your target number. And small lifestyle changes can lead to big impact. And if you find out that your blood pressure is elevated at an early stage, you can actually prevent it and save life. Thank you all for giving me this time to share this with you.
Thank you so much, Dr. Craig. It was really insightful. And we have some very interesting questions coming up. Perhaps you could answer it in the chat, but I think we'll have more detailed discussion about that after our second session. So, over to you, Emma. I think we're gonna start with some tips on how to manage your blood pressure if it becomes too high.
Okay. Thank you very much. Can you all hear me?
Yes.
Okay. Thank you, Dr. Greg, for that impactful, comprehensive presentation. That was really good. So let me share my screen at this point. Can you see my screen?
Yes, something is coming in. Currently is blank. It is still, oh, yes, I can see your screen.
Can you see it?
Yes.
Okay, thank you so much. Yes, today we're talking about the silent killer you can beat. And I want everybody who is listening to us today to keep this in mind. And like Dr. Greg rightly said, it's not a death sentence. You can actually beat it. But it takes knowledge first. They say knowledge is power. It takes dedication, to be able to reverse whatever damage has been caused. And also, as a follow-up, just because you are, having a gene or genes, or you are predisposed to high blood pressure or hypertension, doesn't mean that you will necessarily have it. Because there are many people who are predisposed, but they don't, because they have lived the lifestyle that doesn't put them, or that at least helps them not to develop hypertension. So Dr. Greg's presentation was very explicit, and what I'm going to walk you guys through is kind of complementing what he has said. There might be some, overlappings, but that's okay. It's never a problem when you get the same thing a couple of times. So yes, thank you. So now the way that I have approached my presentation is from a frequently asked questions point of view. And the reason why I decided to do this is because I have guidance sessions with immigrants every Thursday. And these are some of the questions that have come up repeatedly. So I kind of feel that these might be also questions that even our audience listening to us today might have in mind. But please also remember that you can use the chat window just in case I did not address any of your questions or your concerns. So the first one is, I get this question all the time. Why should I measure my blood pressure if I have no symptoms? And I think Dr. Greg said it so nicely. It is a silent killer. It's a monster that eats you up within for so many years, 10, 15 years before you even start getting the first symptoms. And by the time you get the first symptoms, enough damage has been caused within the body. So for that reason, it is very important that we frequently check our blood pressure. It is actually advisable that everybody should own, Dr. Greg calls it a sphygmomanometer, but I would use the word the blood pressure meter just for the sake of this discussion and to make it easier for you guys. So get a blood pressure meter for yourself. It is not so expensive, and just make sure that you measure your blood pressure at home. Prevention is better than cure. So regular checkup will definitely help you to be able to identify or your healthcare provider to dictate if there's a problem early as possible, as early as possible, and so you can get the right help that you need. And if the high blood pressure is detected earlier, then you can imagine all the things Dr. Greg talked about, heart attack, stroke, kidney damage will be prevented. And then the second question is, if I am already taking blood pressure medication, do I still need to measure my blood pressure? This is the mistake many people make. I see people come to me and they are surprised that their blood pressure is high. I mean, extremely high. And the question they ask me is like, but I've been taking medication. Why should my blood pressure be high? And my question back to them is, have you been measuring your blood pressure? Because even if you're taking medication, it doesn't mean that you should not measure your blood pressure at home. There are many reasons why you should do that. The first thing is that maybe the medication is not suitable for you. There are many people taking blood pressure medication that is not suitable for them. There are studies that have also come out with findings that there are certain blood pressure medications that do not go with certain ethnic groups. And not all doctors necessarily or do understand this. So it's important to measure your blood pressure, first of all, to make sure that the medication you're taking is correct. Secondly, maybe your lifestyle has not been adjusted in a way that the medication should work properly. So you're doing the wrong things, even though you're taking the medication. And in some cases, the dose is no longer sufficient. Or even as you age, like Dr. Greg said, as you age, so too are things slowing down as a normal physiological change. So you might need extra dose or a combination of different kinds of medication. So it is very important for you to constantly check your blood pressure at home, even if you are on medication. How often should I measure my blood pressure at home? Good question. So it depends. Are you taking blood pressure medication or you are not? Okay. If you are just a normal person, everything is okay. Like Dr. Greg rightly said, measure your blood pressure every now and then. Or if you have certain symptoms, which I'm going to talk about, you might want to measure your blood pressure to check if the reason for those symptoms are because of a high blood pressure or your blood pressure is high at that moment. You might want to do that. But basically, you should, after when you start a medication, the doctor would advise you to measure your blood pressure. And please do it. Just follow the instructions. Measure your blood pressure regularly, every day, for about a week, or depending on what the doctor is going to tell you or the guidance he's going to give you or instructions. You should do that regularly, morning and evening. And when we say morning, we are not talking about morning at 10 o'clock, because again, the thing that many people tell me about is, I measured my blood pressure in the morning. And the question I ask them is, at what time precisely and what were you doing? Oh, yeah, I went downstairs and after I drank a cup of coffee, then I remembered that I should measure my blood pressure, so I measured it. No, what we are asking you is to measure your resting blood pressure. That's the most accurate, because if you don't do it at the right time and avoiding certain foods, then the measurement, the readings you're going to get would not be accurate. When you get up in the morning, this is the guidance I would give everybody or anybody. When you get up in the morning, make sure that you go to the restroom and empty, pee if you feel like peeing. Make sure that you really, get everything out. Then you sit on the side of the bed, or if it's on a sofa or on a chair in front of your table, and measure your blood pressure. Don't take any caffeinated drinks or eating food or anything 30 minutes prior to measuring that blood pressure. The readings will be different. Don't also take your medication. Don't take medication. Measure it first thing in the morning, before food, before medication. Then another time when it's important to measure your blood pressure twice a day is if you have been given a new medication. Your medication has been adjusted. It would be nice to do that and make sure you record it. Record it in the morning, record it in the evening. And keep the log.
No, it's my next.
Okay, he's not talking to me. Then if your blood pressure is stable, you're still taking medication, but it is stable, please try to measure your blood pressure 2 to 3 times per week. It is very important. If you realize that the numbers are not within the normal range, it would be important to do it for a week and then you consult your healthcare professional or healthcare provider. How do I measure my blood pressure? Dr. Greg already mentioned something which I think is very important, because if you don't do it correctly, you will not get accurate results. That's a fact. So I already said that avoid any caffeinated drink 30 minutes before the measurement. Don't do any heavy physical activity. We're talking about blood pressure, and anything, movement, any exertion, any physical activity is going to increase those numbers. Avoid smoking as well before you measure your blood pressure. It is very important that you sit comfortably on a chair. As you can see this lady, sit comfortably on a chair. Make sure that your feet are flat on the ground. Your arm is resting on a table. This is very important. Now, get a blood pressure cuff. I'll show you a picture later on. That is the correct size. When you place your arm, make sure it is facing up, not down. There are a couple of reasons for that. When your arm is facing down, you might be putting more pressure on the artery. You want your arm to be flat, like up, facing up. Then you should sit down quietly for about 5 minutes before you do the measurement. It's important not to talk. You might have your children, you might have your partner, you might have somebody around you who is trying to talk to you at the same time. It is important to instruct them not to speak to you during the time when you're measuring your blood pressure, because it is going to influence the results or the readings you get. It is advisable to measure it 2 to 3 times. For the most part, 2 times is good, except in a situation where it is higher or higher than normal. So when you measure that, also record the average of all the measurements. So if you do it 3 times, record the average of the 3 systolic pressure and the 3 diastolic readings that you get. Then the next question is, What should I do if my blood pressure is high? What should I do? It's important to stay calm, rest for a few minutes, and then you can check it again. Because even a sudden bad thought or feeling can influence the readings. There are so many things that can influence those numbers. You suddenly hear or you're watching news and you see pictures or you hear something that is very unpleasant or that is shocking. That can affect your blood pressure. So please, it is important that you stay calm. If the first reading is higher than it should be, just relax, calm, take in deep breath, and even a deep in and deeper out, and measure it again. If it remains high and you are having symptoms like, explosive headache, shortness of breath, you're having chest pain, like chest tightness, chest pain, excruciating pain, it would be super important to consult your healthcare provider. Or why not? In some cases, you will need to call 112, those who live in Finland, because the doctor would definitely need to do further check and determine if the medication is okay, and also advice and guidance on lifestyle changes. What should I do if my blood pressure is low? I think Dr. Greg also touched on this a little bit. I remember a client once asked me, Emma, which one is the lesser evil? Is it hypertension? Is it high blood pressure or low blood pressure? And I looked at her and I laughed. I'm like, I don't know if there's any lesser evil. Because like Dr. Greg said, yes, we high blood pressure and low blood pressure are both dangerous. They are both dangerous. But you might, in a case where you are already hypertensive and you're taking medication, sometimes your blood pressure can also go lower, that you start having real symptoms. And some of the reasons for that could be that you've been, going all day without food. You have cut on salt completely. We have people who think that salt is the evil. It is excess salt that has a problem, but your body needs salt. But when you do it too much, that's where it becomes a problem. So you have people who are taking medication and they've cut back on any like salt. They don't eat it at all, nothing. Then they go a whole day. They don't drink. They have not been drinking properly. And all of these things will reduce the blood volume and your blood pressure will drop. So it is very important to also consider that this is something that can happen. You might also take overdose of the medication. Maybe you don't remember if you took the medication and you take it again. Or even you might have low blood pressure when you did not even know. I have patients who come to me and they didn't know that they have hypertension. But remember that when your systolic pressure is already below 90, then you are considered as somebody who is hypertensive. So it is also a problem. But in case you find yourself in a situation where your blood pressure is low and you are having all the symptoms like dizziness, you're having lightheadedness, you feel like fainting, you feel like vomiting, you're generally weak. What I would tell you first thing to do is make sure you drink enough water. If you feel like you're dizzy, drink enough water. First thing, drink water. If you have anything that is salty, like I have some pictures here, pickles, salty cheese, and all the other things you see on the picture, harm You have ham there, you have olives or sauerkraut. All of those are some of the foods that are high in salt that will help you. But if those symptoms are severe, please seek medical help. Where can I buy a reliable blood pressure monitor? You are advised everybody should have a blood pressure meter at home. Everybody. It's not expensive. It's not expensive. You can have blood pressure meters for 50 euros, sometimes even on sale, 50% sale, 40 euros. You don't necessarily need to go for the Omrions that are 120, 200 euros and things like that. You can have even the basic blood pressure meter will do you a lot of good in terms of monitoring your blood pressure at home. Pharmacies, you have those. You have different medical supply stores. Well, then you also have online retailers. They all sell blood pressure meters. It is also important that, or we do advise that you buy an automatic monitor because it's easier for anybody. You don't need extra education to use that. But also make sure that the cuff is always an upper arm blood pressure meter. As you can see, this is something that many of you are familiar with. But also you have the risk monitor. The upper arm monitor or cuff is more reliable than the risk monitor. So you want to get the upper arm one. And then when it comes to accuracy as well, the size of the cuff is important. The size of the cuff is important. So you want to make sure that you're getting a cuff size. Most people, medium would be okay, but then if your arm is big, so you need, a cuff size that is suitable for you. What are the lifestyle changes that can help to maintain healthy blood pressure? Balanced diet, rich in fruits, vegetables, and then low in salt, as you could see. Doc already mentioned that. Max 5 grams of salt a day, that's recommended. Regular physical activity on most of the days. You don't need to be in the gym every day, just walking. Just make sure that you have, they usually say 150 to 300 minutes of physical activity a week is good. Limit alcohol. So the question is, what is alcohol in moderation? There are many schools of thought when it comes to something like this. What do we mean by alcohol in moderation? But you should not drink for the most days of the week. And you drink in a way that you still can, be able to function normally. But I have to say that if I'm sitting here and telling you that it's a glass of wine, or it's it's one beer, there are different recommendations. But if you can avoid alcohol, good for you. But if not, limit it. Same with cigarette. Managing stress is important. And staying or keeping a healthy weight. And what about sleep? I think Dr. Greg also touched on sleep. But I opened some of these things up. Key nutrients that you need when it comes to reducing high blood pressure are magnesium, potassium, and D vitamins. So you want to make sure that you are consuming foods that are rich in magnesium because they relax your blood vessels. And that would not put a strain to your heart. It doesn't make your heart to work harder than it should. Because your blood vessels, the pipe, like you saw from Dr. Greg's slide, they are more relaxed. It is very, very important. Potassium, you definitely need potassium. One of the reasons why people have hypertension is also because their diet is very low in potassium. You need food balance. So you need to balance things up. Potassium will help to get rid of the excess fluid in your body. That will in turn lessen the strain on your heart or your arteries. D vitamin is the mother of them all. Remember, every cell in your body has a D vitamin receptor. You definitely need D vitamin for magnesium to do its job well. Some things that are very common, which you probably have in your kitchen, in your fridge, right? Just wanted to throw more light on these things because some of us, we consume them daily, some of us don't. I spoke with somebody who said, I've never, eaten spinach. I don't know. I've never eaten kale, arugula. So these are foods, these are greens that are very, very high in magnesium. In fact, all of these foods that you have here, they are high in magnesium and in potassium. Avocado do good when it comes to potassium. Dark chocolate, bananas, berries, oranges, grains. These are all things that will help to lower blood pressure. Then we talk about the seeds. I call these the powerhouse. They do not only lower blood pressure, but they help to provide nutrients to the trillions of the tiny little, I call them, whether you want to call them monsters, the bacteria in our gut. They feed on some of these goodies that you see on this picture. Pumpkin seeds, for instance, is so high in magnesium. The timing that you consume these are also very important. For instance, pumpkin seeds we are advised actually to consume pumpkin seeds more in the evenings. Just 2 tablespoons of pumpkin seeds every day will help a lot. You have flax seeds, you have chia seeds, hemp seeds, you have mixed nuts. These are all things that are very good in lowering your blood pressure. Your omega-3 that's coming from fish, sardine, you have olives, olive oil, and all these things. Kefir is also an unsweetened milk, which has a lot, when I mean a lot, I mean millions of bacteria in them or in it, which is super important for our gut. Remember, there's a saying that what happens in Vegas ends in Vegas, but what happens in our gut becomes a systemic problem. So if you take care of your gut health, it will help also to stabilize your blood pressure. And these are all things that our gut needs. But I wanted to also touch on some ethnic, so we don't think that, it has to be only, things that you buy from the Finnish shops and all of that, or grocery store. These are some ethnic foods that have been proven as well to lower blood pressure. Here we are having all these greens. I don't know if these greens are familiar to you guys. Are they familiar? Amaranth leaves, you have spinach, and you have pumpkin leaves, you have okra. These are all things that you find them from the aubergine, cabbage, yams. You have cassava there. All these greens and the African and Asian tubers, these tubers are packed with all kinds of vital nutrients and plus resistant starch. They don't spike your blood sugar like rice would do, for instance. So these are all some of the foods: brown rice, black-eyed peas, and all this stuff, all the grains, lentils, all these different types of lentils have been proven to lower blood pressure. So you just need to incorporate them into your diet. Some herbs and spices as well, that research has shown that if you incorporate this in your diet, it will help to, or they have blood pressure lowering effects. So these are some of them here. We have, for instance, black cumin, onion, cardamom, right? So all of these things, sesame seeds, ginseng, these are all things that are super important. So try to incorporate these into your diet. It is also good. Now, something I wanted us to talk about, which so many people ignore. Please tell me if I still have time or I'm running out of time. Something that so many people ignore, which is also having a huge impact on our blood pressure. There are two things I wanted to talk about. That is sleep and stress. And the reason why I chose these two is because with everything that's going on in the world, people are not sleeping enough. People are stressed. And when we talk of stress, Dr. Greg talked of distress, but I'm talking about chronic stress here. It's been accumulating. It's like a time bomb. Chronic stress. There are so many of us, when you turn around every single day, it's about our work, it's about what's happening in the world, it's about your experiences with people, it's about stress from the family, it's about your job, it's about everything. So I want us to touch these two things, and I'm going to go through them quite quick. The first one is sleep. When you don't sleep, you put your body in a fight or flight mode, like autopilot. And your body releases, hormones that are not good. Cortisol, for instance, adrenaline. Cortisol is a fat storage hormone. So what it does is it preserves everything. It's one of the leading causes of obesity as well. When you don't sleep, you realize that you tend to increase, and your waistline tend to increase, or your weight increases. Chronic sleep deprivation also has been known to increase what we call insulin resistance. So your body can no longer utilize the insulin that the pancreas produces, which should help, to get whatever food that you've eaten into your cells. There are also certain inflammatory molecules that your body produces when you don't sleep. And when your body produces these inflammatory molecules, what they do is that your vessels, they constrict. They don't relax. They don't relax. And we need our muscles, that pipe, to relax, not to be like this, to relax. So we are aiming for 7 to 9 hours of good quality sleep per night. It's not about the number of hours, it's about the quality. So your focus should be on the quality. A couple of things that you can do to improve your sleep. Maintain a consistent sleep schedule. I know easier said than done, but it's important to be conscious about it. A darker room, quiet, limiting your screen time. Many people take caffeine and alcohol before bed. I can tell you, you drink alcohol, you can sleep 10 hours, but the quality of the sleep is not good. You can sleep for 10 hours, but I'm focusing on the quality of the sleep. Physical activity later at night is not good. And also managing your stress by different relaxation, mindfulness exercises before bedtime. Oh, stress. I already talked about this. Again, just as sleep would do, when you're stressed, your body releases similar hormones. It increases your blood or your heart rate, constrict your blood vessels, so your heart is working super hard to pump blood. The change, if it's just a temporal thing, let's say suddenly you got a really terrible news from home or from your environment, or you lose your job and you are stressed. If it's a temporal thing, it's okay. But when it's consistent, then it is a problem. That is where you can be expecting stress to lead to hypertension. And for many people, the stress is consistent. It's consistent. So what we need to do is to identify individual coping mechanisms. What is it that is for me a way to de-escalate, to relieve myself from the stress? What works for me might not work for you. But there are certain things that studies have proven that they work. Deep breathing exercises, mindfulness meditation, thinking of the moment, focusing on the present moment, going for a walk. The antidote for cortisol is walking. The antidote for cortisol is walking. So if you are in an environment where you can walk all the time, sometimes I tell people, if you're having a bad thought or you feel like you're stressed or something, your wife, your husband, your children, or something is just, making you tense at that moment, go for a walk or just walk around your house. The antidote for cortisol is movement. And the simplest of them is walking, so you don't strain your body. Walking is the best thing to do. Regular physical activity, adequate sleep, a balanced diet, we've talked about it already. A diet that has all the phytonutrients, macro and micro, all the vitamins, social support, so your environment, your social network, hobbies, and managing your time effectively, because time management has also been proven to be one of the causes of stress. We are just multitasking so much that we are not able to meet up. There are people who want the day to be not 24 hours anymore, but 48 hours or 36 hours, because there's just so much going on. But if you can learn how to manage your time and plan your activities better, it is going to help you with the stress. Whom and where to contact? I think Dr. Greg also touched on this, so I'm going to go really quick. Your healthcare provider, or primary healthcare, sorry, that's your healthcare center. It's important to book an appointment. And this is what I tell people. If you realize that your blood pressure, you are not hypertensive, you've not been diagnosed before, but you measure your blood pressure, coincidentally, as you always do, once a month, twice a month, or twice a week, or once a week, however you do it, and you realize that the number is higher than it's supposed to. Okay? So what you should do is just monitor it for a week. Take it morning and evening. Measure it in the morning and in the evening. And keep the log when then book an appointment with your healthcare center or provider. Go to see them with that sheet that has all the readings. Your healthcare provider will definitely check it. The doctor will maybe ask for further testing, and then you will have some guidance, whether it's medication or it's about lifestyle changes. Some of you have occupational health doctors. Many of you are working, but you have never understood that you have the right to go to your own occupational health doctor at least once a year, and just do the basic blood count and blood pressure checkings. Basic. So utilize that, please. It is your right. When should you call 112? Yes, there are some situations where you just have to call 112. Please don't wait. Don't say that I'm going to wait to see how things are going to, play out. If your blood pressure is extremely high, we're talking of over 180, that's the systolic, and the diastolic is over 100 or 110 and above, and you are having these symptoms, please call 112. Usually the headache, it feels like your brain is going to pop out. You will have chest pain. You will have difficulties breathing. You're gasping for air. You're having weakness. Maybe both arms, there's numbness. You're having difficulties speaking. Vision changes. This might just be a sign of an impending hemorrhage. This might be, you can prevent a stroke by just calling 112 at the right time. You might prevent a heart attack by just calling 112 at the right time. So this is the guidance, because there are no symptoms. You just never know what's going on within the body. Okay? So I'm going to end here. And if you have any question, this is the time that Dr. Greg and myself will try to answer those questions.
Yes, we have a lot of questions coming in. Thank you so much, Emma. It was a very useful presentation. I think we learned a lot from your tips, since high blood pressure is such a common problem. I think I'm going to stop the recording now, and just a reminder to everybody here that you can turn on your camera and mic for the questions as well. I'm going to go with the questions in the chat first, and